Thank you for joining us. We're going to explain Medicare A, that's Part A, but to give you an explanation of the Medicare system, just to give you an idea of the different parts that we're dealing with, this is a chart that says your Medicare coverage choices at a glance. And what this is talking about over here is the original Medicare, which is what you'll default to when you turn 65. Here's Part A, and here's Part B. Part A is automatic for everybody who has worked the 40 quarters or was married to somebody for 10 years who worked 40 quarters. That'll be automatic. B is optional, and C is optional. But we're going to talk about Part A in detail, give you an understanding of what Medicare Part A covers, who it covers, how it covers. Medicare Part A, who it covers, and what it covers. Covers any U.S. citizen that's worked 40 quarters or more, that's 10 years. Covers any U.S. citizen married for 10 years to somebody who worked 40 quarters or more. It starts automatically on the first day of the month when you turn 65. And on the first day of the month for those who have been disabled 24 months after they've been disabled. Part A is secondary to group insurances or individuals. So if you're working for a corporation and you keep their group insurance, Medicare is just in the background. And the only time it pays is if a group or individual coverage does not cover one of the 4 parts of Medicare A. It's primary if you give up your health insurance, individual or group, and it takes over. So Medicare standalone will take over. Any U.S. citizen can take Medicare Part A if you qualify for 40 quarters, 10 years. You will not have to pay for Part A. Or if you have end-stage renal or railroad retirement disability, you will also not have to pay for Part A. So if you work less than 40 quarters, you'll have the opportunity to purchase Medicare Part A. What does Medicare Part A include? Hospitalization, skilled level nursing home, home health care, and hospice care. But just a note, Medicare A covers these long-term care parts, but not long-term. It's very limited, so it doesn't replace long-term care coverage. What about the hospitalization of Part A? Well, first you have a deductible. So if you have no Medicare supplement and you're just using Medicare Part A, you pay your deductible. It's good for at least 60 days at 100%. Days 61 through 90 pays all but $335 per day. So those periods of time, if you're in the hospital, that's how much you'll owe each day in the hospital. Day 91 and beyond, you owe $670 per day for up to a maximum of 60 days. Past that day 91, you have access to one-time 60 days lifetime reserve days. Once you've used those up, then your coverage is, even for a new occurrence, you don't have any coverage past day 90. There's no coverage past 90 plus the 60 days of reserve. So once you've exceeded those, there's no more coverage. Medicare Part A skilled nursing coverage. After you've been in the hospital, it'll pay for 20 days at a skilled nursing facility. So the hospitalization has to be 3 nights inpatient stay. You must have days remaining in your benefit period. So if you've exceeded the benefit period of say the 90 days plus the 60 days reserve, then there's no coverage for you. Day 21 through 100 in a skilled nursing facility, you will pay $167 per day. Day 100 and beyond, you pay all costs. This may reset at a skilled nursing facility care if you're out for more than 30 days and have a 3-night hospital stay. If you're out of the skilled nursing facility for more than 60 days, your maximum of 100 days resets itself. So the 30 days out works as if you're in a skilled nursing facility for, say, 25 days and you're out for 30, it's as if you're going back in on the 26th day. But if you're out for 60 days or more, you get the full 100 resets. Medicare Part A home health care pays when you're certifiably homebound. Must have difficulty performing activities of daily living, dressing, continence, those type of things. Coverage ends when you have plateaued or are no longer recoverable. In other words, if you've had a stroke and the doctor said, well, you're at 50% capacity and that's as far as you're going, then the home health care benefit ceases. Medicare Part A hospice pays in your home or a facility. It's triggered if the doctor says you have less than 6 months to live. You also must agree to give up any further treatment of recovery. In other words, if you're being treated stage 4 cancer and you want to continue getting treatment for that to maybe stop the cancer, then you cannot use the hospice benefit. You have to give up any treatments to be able to receive it. Basically, it is only for comfort care, end-of-life comfort care. So that's the 4 parts of Medicare A: in-hospital, skilled nursing, home health care, and hospice care. From Medicare's Plans, thank you for listening. If you have any questions, please feel free to go to our site, medicaresplans.com, and ask any questions you'd like. Thank you.